We've talked a lot about using equipment to prevent injury. In a lot of sports, athletes will spend a certain period of time before they participate in their athletic activity warming up. Is there such a thing for skiers, and if so, what do you recommend?
You know, most of the studies have never been able to show that it's protective in skiers, but logically it makes sense that it would be beneficial. We recommend that they all do some type of warm-up beforehand, but probably the most important thing that a skier can do is to be in good shape before they go skiing. We hear a lot of skiers from elsewhere who come to Aspen. They'll try and get in good shape before they come to Aspen, but if they don't do it for a good 6 to 12 weeks before they go skiing, it's really not going to be a much benefit to them. So we recommend that anybody who's going to be skiing try and do some type of a pre-season ski exercise program at least 6 to 12 weeks beforehand. If they try and do it 2 weeks beforehand, then they're probably going to just develop overuse syndrome and probably not worth it. Skiing at a low level at first when they first get here is always beneficial, and then gradually increasing it. I think one of the most important things that we can tell people is to quit when they're tired. The better shape you're in, obviously, the longer you can ski for, but it's probably much more beneficial just to stop when you're fatigued and not try and get one last run in before the end of the day.
So it is. That brings up an important point, I think, is that if you're tired, your body becomes fatigued. Your muscles can't protect you as well as they would if you're well rested. So, what would you say about during the course of a day? A full day of skiing. How important is it to take breaks and to remain well nourished? Make sure you're eating and drinking properly.
Muscles account for at least 90% of the protective forces about the joint. And so the stronger your muscles are, obviously, the less likely you are to have some type of an injury. So we usually recommend that, patients take a break at some point during the day to make sure that they can give their muscles a chance to recuperate. Obviously, being well nourished is appropriate. Being well hydrated is beneficial for a variety of different things. And the avoidance of alcohol is probably very important in addition. People are at high altitude. Alcohol tends to make them more dehydrated, tends to alter their judgment, makes them feel that they can do things that they probably shouldn't. So having that glass of wine or beer with lunch is probably not very beneficial for people.